Differential diagnosis of weight loss in an adolescent. This disease considers celiac disease, Crohn's disease, depression, diabetes, eating disorder, anorexia, bulimia. Heart failure, hypercalcemia, increased calcium, leads to decreased appetite and abdominal pain, hyperthyroidism, parasite infection, PUD, ulcerative colitis, side effects of drugs, anxiolytics, and stimulants, endocrine hypothyroidism, hypothyroidism, diabetes, GIT, gastritis, celiac disease, IBD, renal failure, infection, TB, HIV, cystic fibrosis, psychiatric disease of the use of substances. Weight loss in an adolescent can stem from a broad spectrum of causes ranging from normal variation in growth and development to more serious underlying medical or psychological conditions. Although assessment is crucial for identifying the root cause, here's a structured approach to understanding the differential diagnosis of weight loss in an adolescent. Characteristic symptoms and pathophysiology monitoring weight loss often associated with underlying medical conditions such as chronic infection, gastrointestinal disorders, endocrine abnormalities, or malignancy. So voluntary weight loss may be related to eating disorder, body image issues, or excessive exercise. Clinical presentation and diagnosis. The evaluation should include a comprehensive history including dietary, exercise, and social history, physical examination, and possible laboratory and imaging studies to identify the cause. The key areas to explore include eating disorders, anorexia nervosa, bulimia, symptoms, preoccupation with food, body weight, and shape, secretive eating habits, menstrual irregularities. Diagnosis based on DSM-5 criteria including restriction of energy intake, intense fear of gaining weight, and distribution in self-perceived weight or shape. Gastrointestinal disorders, inflammatory bowel disease, celiac disease, symptoms, abdominal pain, diarrhea, blood in stool, malabsorption. Diagnosis, endoscopy, biopsy, specific serological tests. For example, anti-TTG for celiac disease, endocrine disorder, hyperthyroidism, diabetes. Symptoms increased appetite with weight loss, palpitation, hyperthyroidism, polyuria, polydipsia, diabetes. Diagnosis, thyroid function test. Fasting, blood glucose, HbA1c, chronic infection, tuberculosis, HIV, symptoms, prolonged fever, night sweats, chronic cough, TB, various systemic symptoms depending on the stage, HIV diagnostic chest X-ray, sputum test for TB, and is a confirmatory test for HIV, malignancy, lymphoma, and leukemia. Symptoms, unexplained weight loss, night sweats, persistent fever, lymphadenopathy, diagnosis, with differential, managing studies, and biopsy. Psychosocial issues, depression, anxiety, symptoms, changes mood, sleep disturbances, loss of interest in activities, diagnosis, clinical evaluation, psychiatric assessment, treatment depends on the underlying cause and may range from nutritional support and counseling for eating disorders to specific medical or surgical treatment for gastrointestinal disorders. Endocrine disorders, infection, or malignancies. Prognosis, general outlook, highly variable and depends on the underlying cause and its time, diagnosis, and management. Condition-specific early identification and appropriate treatment generally improve outcomes, especially for conditions like eating disorders and endocrine abnormalities. Differential diagnosis table. Condition, eating disorder, preoccupation with weight, restrictive eating, require comprehensive psychiatric and nutritional management. GI disorder, abdominal pain, malabsorption, diarrhea, endoscopic and histological diagnosis. Specific treatments, endocrine disorder, symptoms of hypermetabolism, polyuria, polydipsia, hormonal assays for diagnosis, specific hormone therapies, chronic infection, fever, night sweat, chronic cough, infectious workup, antimicrobial therapy, malignancies, unexplained weight loss, lymphadenopathy, imaging, biopsy, oncological treatment, psychological issues, mood changes, anxiety, sleep disturbances, psychiatric evaluation, psychotherapy, and/or pharmacotherapy. High endpoints of thorough history and physical examination are critical in the assessment of weight loss in adolescents to guide further diagnostic testing. Consider psychosocial factors and eating disorders, especially given the age group. Early diagnosis and treatment of underlying cause can significantly improve the diagnosis. Identifying the cause of weight loss in adolescents requires careful consideration of a wide range of differential diagnosis involving multidisciplinary approach toward effective management and support. So let's sum up. Differential diagnosis of weight loss in adolescent autism disease, cancer, celiac disease, Crohn's disease, depression, diabetes, eating disorder, heart failure, hypercalcemia, increased calcium lead to decreased appetite and abdominal pain, hyperthyroidism, parasitic infection, PUD, ulcerative colitis, side effect of drugs, anxiety, stimulants, endocrine hyperthyroidism, hypocortisolism, diabetes, GI tract, gastritis, celiac disease, IBD, renal failure, infection, TB, HIV, cystic fibrosis, psychiatric disease, or use of substances. The involuntary weight loss often associated underlying medical conditions, and voluntary weight loss may be related to eating disorder and excessive exercise. The eating disorders like anorexia nervosa, bulimia, gastrointestinal tract, inflammatory bowel disease, and celiac disease, endocrine disorder, hyperthyroidism, diabetes, chronic infections, tuberculosis, HIV, malignancy, lymphoma, leukemia, psychosocial issues, depression, and anxiety. Treatment underlying the cause and prognosis general condition specific. I point thoroughly to physical examination, psychosocial factor, early diagnosis, and treatment.